Let's have lunch. We are about a week away from getting back to work here, and we are looking forward to it. I just want to make a couple announcements. We're going to have a fun little video just to show you what we're doing to make sure we're protecting our team safety as well as your safety. I think most of you know that we are an accredited surgery center, so these are not unfamiliar things for us. But if you want to wear a mask, wear a mask. We probably will take your temperature when you and we're taking our team's temperature twice a day. We're trying to keep the doors ajar or open so that you don't have to touch anything. And we've got plenty of sanitizer and all of those things around. So we want you to be comfortable. I think we all want to be comfortable as we start getting back out to a new normal. But we are super excited that we're finally at this point. So today, one of the things that has been going on, and I know there's been a lot of discussion about Georgia opening up and hair salons opening up and nail places and so forth. I think we're all feeling a little bit blah. I guess that's the best way to say it. We're just tired of being tired, and we want to start looking, feeling better. And so one of the things in our practice that's such a big deal, no matter if we're doing surgery or injectables, are virtually every patient, we are discussing best skincare practices. And today, we have Wendy back, along with Hope Mers. Wendy is our esthetician who does a beautiful job. She was on a prior segment where we were checking out her lip and some other things. And I think you all know Hope as well. So they really represent our skincare team. Wendy and Hope are really experts in this area. And so Wendy today was going to review chemical peels. Chemical peels have been around for a long time, but she's going to talk about some of these things that we can do as we start getting back to life. And I think these ladies are going to be super busy here coming up. But anyway, so I'm going to turn it over to Karen Lynch, and she's going to take it from there.
Well, you pretty much said it all, but the secrets to a spotless and flawless complexion is lying just beneath the surface of your skin. So today we're going to talk about the skin and what you can do to just make it look refreshed and beautiful.
All right, so hi everyone. As you probably remember, we've talked about a lot of different skincare treatment options over the last couple weeks, and today we're going to go over something that addresses the more superficial areas of the skin, stuff that we see on the surface, everything that bothers us from pores to brown to acne and everything in between. So Wendy is going to go over a great option called chemical peels and what this means for your skin and different skin types and tones. So Wendy, I'll let you take it away.
Thanks, Hope. Okay, well, as a lot of you probably know, the clients that come to visit me, I believe that chemical peels are one of the best, quickest, fastest way to rejuvenate the skin, to brighten it up, give it a little glow. It's if you have the time involved, depending on the layer of the peel and the strength of the peel, that it can do great things like a quick fix, basically, to the skin. So it can be a great rejuvenating treatment for the skin. So the chemical peels, basically, a little bit of information on them. They're used to improve the appearance of the skin. And in the treatment, it's a chemical solution that we apply to the skin. It causes the skin to react and eventually peel off. What this means is it exfoliates the outer layer of the skin, the epidermis, and it will improve the skin's texture, the tone, as well as the pigment layer of the skin. So it also replaces, in the process of doing so, it replaces old skin with fresh, new, and healthy skin. And this skin is smoother, clearer, brighter, and tighter, with fewer lines and wrinkles. So it's a great way to start the process of just rejuvenating yourself after a long summer, possibly going into the winter time when you have that time that you can afford to peel a little bit. We usually do peels on the face, neck, and the hands, but certainly the chest as well as the forearms as well as the back also benefit greatly from chemical peels. We see great results with that. So the chemical peel options are basically alpha hydroxy acids, beta hydroxys, as well as lactic acids, retinoid acids, as well as the glycolic and salicylics. They are all basically able to be customized to create benefits for correcting acne, sun damage, oily, as well as aging skin. So there's a lot of options that we can do. And the deeper the peel, the more dramatic results that you're going to see. But also comes with the fact more care and more recovery time that you'll need. So we always recommend a consultation to help determine the right peel for your skin type as well as your lifestyle needs. As something to take into consideration, and to realize that you have to dedicate a little bit of extra time to some different layers of peels, which goes into the next one, the medium peel. But first, let me tell you, the best way to start off, if you've never had a peel, to introduce yourself to it, is to do a superficial or light peel, sometimes called the lunchtime peel. It removes only the top layer of the skin, which is the epidermis, and this peel will instantly brighten and give your skin a fresher, smoother look in appearance. It can minimize fine lines and wrinkles. Sometimes it can actually give you a little more softening to mild acne scarring, age spots, as well as dry, flaking skin. So it's not going to be a big game changer, but it definitely will give you a good place to start with the skin, to rejuvenate the skin and get that cellular turnover started. So it's a great place to start. I highly recommend them. Sensitive skin can tolerate this, all types of Fitzpatrick's, as well as the rosacea skin, acne skin. It's a great treatment for these. It will help calm a lot of issues down in the skin, as well as I said, just giving it a good glow and a nice, fresh, healthy look. So these peels do not hurt. You only feel a slight, maybe tingling or stingling. If my clients remember, my keyword is stingle. I always tell people this is what you'll feel a little bit, but literally no downtime whatsoever. And you'll be a little pink maybe afterwards, and may get a mild flaking to the skin. But this could be covered up with makeup. You actually basically can go back to work. That's why they call it the lunchtime peel. You can go back to work, or you could go out that evening and nobody is going to suspect anything that you had anything done that night. So you can apply makeup. And so it's a great way to start. And it's a fun thing to do, to explore. And I guarantee that you'll probably be addicted, as I am, to chemical peels eventually. So that could be a good thing. But downtime is usually 1 to 2 weeks from start to finish with the light peel, the superficial lunchtime peel. But and usually 6 to 8 treatments is what I recommend, and doing them about 4 weeks apart, to really see and to benefit from that layer of skin, or that layer of peel, I should say. And sometimes you'll do a few peels. I find a lot of clients will do, and then they'll say, well, can we switch it up and maybe get going on a stronger peel? Then, the next level, which I'm always game for, as long as your skin's not compromised and it fits into your social calendar as well, and you're comfortable with everything. I say, let's go for it. So usually we monitor the skin and see how things are going. So that's something that can always be upped, and we can take you to the next level very easily with that. Being the medium peel, which gives more of a dramatic results. These peels are derived from the trifluoric acid, the TCA, commonly known as, and they go much deeper into the skin. This peel is going to improve the skin texture, the tone, but it's going to take them both to the next level. It's going to remove sun damage, as well as the melasma and fine lines and wrinkles. I see great results with melasma. Women come in all the time and they suffer from this greatly, commonly caused by hormone fluctuations. So the melasma is tough. It's very, very difficult for women to get results from. And it might lighten up a little bit when they come in from the summer and in the fall and the winter time as the skin peels out. But for the most part, it's always there. It's always lurking. And TCA peels do a great thing, do a great job on that. So I love TCA peels. I'm here to, I'm a true believer in them. So I think it helps a lot with sun damage, as well as some keratosis. It will actually soften the surface of the skin with that as well. So for patients who struggle with acne, it can improve the acne, soften the scarring a little bit, the old acne scars. The downside to a medium peel is that you have a longer recovery time, as I said before. You might feel a little more discomfort during the treatment than you would with a light superficial lunchtime peel. The burning and the stinging, it can actually last maybe about 30 minutes longer or so, up to an hour after the treatment. You may want to hide yourself for a few days, a couple days or so, because it's, you're going to be a little red. You may want to basically put ice on it. You're going to be a little swollen, possibly. Some people do swell up a little bit. You'll sleep with your head elevated a little, but more than likely you'll be pink and itchy afterwards. The skin sometimes is very reactive to that. So you'll get more peeling with this peel as well than you would with a light superficial peel. You could get patches of dark brown skin. It will look almost like you have tanned, or a little bit of leathery texture to the skin right before it starts releasing and peeling. So this is something that happens during the peeling process on a medium peel. The recovery time usually takes about 2 to 3 weeks, a little longer. And be patient with this, but your skin can be a little pink up to a few weeks after. So I really stress to people that you must keep up with the daily regimen that we provide for you, as well as applying the sunblock, the sunscreen daily, and reapplying it. I tell my clients all the time, it's not the first application of sunblock. That is the most important. It's the reapplication of sunblock. That's the most important. So after any chemical peel, the skin's going to be sensitive and reactive. And for several weeks, it's going to be very important that you do that sunblock. You'll be a magnet for hyperpigmentation when you go outside unprotected. So, follow up, wear a good mineral zinc oxide based sunblock and reapply it. No tanning. No tanning, all right? That's a no-no. But healthy skin is achieved with regular professional treatments and a proper skincare regimen. And for your skin type and for a healthy lifestyle, it's a great time to explore it and to experience healthier and happier and younger looking skin. It really, truly is. So, you may have, as I said, some breakouts, after a peel. Peels will cause the skin to purge. Some people will call and say, oh my gosh, all of a sudden I'm breaking out. I'm getting these, these bumps and white spots and amelias, and I don't know what's happening. Well, it's not necessarily a bad thing, that stage after a peel. It's the skin purging, and it's the skin layers starting cellular turnover. So all that gunk stuck down in the deeper layers of the skin, it gets brought up to the surface faster, and it's purging the bacteria and the sebum right out. So take a deep breath. This phase will pass. With regular use of chemical peels every 6 to 8 weeks, depending on the level of peels, your skin's going to improve and become so clear and beautiful and fresh and young. People will ask, what are you doing? They may not notice it right away, but they'll say, maybe it's your makeup or maybe it's your hair, but they'll say, you look good today, or your skin looks so nice. In time, you'll become a believer. I trust the fact that all of you will want to try a peel one time or other in your life. I think everybody should. So we have so many different levels of peels for healthy skin and to support the skin. And I just think that everybody should at least try it at least once, twice, 3 times, whatever. But they usually work well in packages. I do recommend that. One peel's not going to bring the skin to where it should be at the next level. So keep that in mind, that if you want to see results and maintain those results, that you should invest in a package of them, at least 3 in a series. That gets that circulation or that cycle of the skin regenerating and cellular turnover, strengthening and processing, so that it supports itself and maintains at a deeper level. And we all want that. So That's kind of my spin on chemical peels. As you can tell, I love them.
You're so good, Wendy.
Oh, yeah.
Well, you are. Besides what you just did, I mean, you've got beautiful skin. You live by what you preach, and I think that's great. I want to make a comment. You said something earlier about keratoses, and so with the TCA peel, which is a peel that years ago I performed a lot of. There are certain percentages. You probably use 10, 15, 20%. I don't know exactly.
Right.
We used to be a little bit more aggressive, and now we use lasers, you know, the dot laser for more aggressive situations with deeper rhytids and wrinkles and so forth. But we used to use 35%, and we used to do some things like that. But I do want to point out, this is a question that I used to get a lot, is does insurance cover it? And my answer to that is these days it doesn't, but from a medical health standpoint, when you're talking about healthy skin, some of these AKs, these actinic keratoses that Hope has talked about before, that can be precancerous, a small percentage of them. Insurance used to cover these sorts of things. This goes back maybe 20 years, 15 years. And the only reason I'm mentioning that is because from a health or a medical standpoint, in terms of eradicating some of the early signs of skin cancer, these can be preventative as well. They can actually be treatment. Obviously, if you have a basal cell or a squamous cell carcinoma, this isn't a treatment for it. We've got to excise that. We've got to remove it. But sometimes I say that because some people feel maybe they're a little bit vain, I suppose, doing something that's more elective. But there's also a medical benefit when we're taking care of our skin. I just wanted to point that out because that's a question that I get a lot.
Definitely, right.
Wendy, I think you did a great job hitting on the major diagnoses we see and treatment for that. I love that you brought up melasma because melasma is one of my favorite things to treat with chemical peels because it's so difficult to treat otherwise. Melasma, for those of you that don't know, is a hyperpigmentation condition. It's inflammatory. So typically it shows up like a mask on the face, on the cheeks, the forehead. It usually looks like a mask pattern. And it is influenced by hormones, as Wendy was talking about. So typically they'll say the mask of pregnancy. So with women's hormones going all crazy. But it does happen with birth controls, or you can just have it and it gets inflamed with sun and heat, different things. So it's hard you can't cure melasma unless you take away the hormonal contributing factor. But during the summertime, typically we kind of back off on melasma treatments a little bit and we go more for prevention with a good zinc titanium sunscreen like Wendy's talking about. And then come fall, we really try to get at that pigment and reverse some of the pigmentation that has left behind. But chemical peels are a great way to do that. So I recommend that a lot for that. Acne scarring is important with chemical peels as well. Dr. Mendelsohn, did you want to add into the melasma?
I wanted to ask you a question because I think that's a really important conversation, melasma, hyperpigmentation. And I know we're not here to talk about other treatments, but if you could, for some of the melasma, maybe you could just talk about the PICO, the focus for a moment, so that people understand where peels and PICO might work together.
Sure. So I think there's a reason we have all these various modalities of treatments for skin, for volume loss, for surgical options. We have different conditions that we need to treat. So what Dr. Mendelsohn is referring to, the PICO focus array, that's a laser that does not use heat. So heat can trigger melanin or the pigmentation in our skin. And that is bad for melasma. We don't want to trigger melanin because it'll make the melasma worse. It's also bad for darker skin tones sometimes. We can use it cautiously, and as experienced laser providers, we will do what we feel comfortable with. But in a darker skin tone, not like me, right? So someone that has more melanin in their skin, you want to be more cautious with certain procedures because that melanin can get triggered and you can create a hyperpigmentation, too much pigment, or you can also create a hypopigmentation and take away pigment that can be hard to reverse. So we're always very cautious when we use heat lasers like the CO2, fractionated lasers, and we want to make sure to use something that is either like a chemical peel where you're not using heat, or the PicoSure focus array uses a mechanical injury. So the laser literally just pulses so quickly that it's creating a mechanical injury. I compare it to like you're dropping a glass on the floor and it shatters. It's basically shattering your pigment under the skin so your skin can reabsorb and kind of shed that off, but it's not using a direct heat injury. So it's safe for melasma, for darker skin tones. We can effectively treat pigment in those patients without worrying about a hyperpigmentation. We also, of course, will want to protect from the sun. So, you know, even if you're a Fitzgerald 4, 5, 6, the Fitzgerald skin level types go from 1 to 6. I would be a 1, right? I don't have much darkness to my skin. And Dr. Mendelsohn might be like a 2, edging toward a 3. And, you know, the darker skin tone you have, you really want to be more cautious. So even if you're a darker skin tone, you still got to wear your sunscreen. I know Wendy will agree. You've got to wear your sunscreen. You've got to avoid the sun. You've got to wear your hats, you know, in the summertime, especially when you're doing procedures. So,
and there's great clothing right now for the sunscreen clothing. Great lines, items, you know, hats, tops. You know, we were on vacation this past last fall, and I was so impressed and so happy to see families, people in the pools, people walking on the beach, you know, wearing their tunics or their long sleeve tops as well as their pants, you know, their hats. And hats have come a long way. 4 inches all around brim. At least it has to be 4 inches to properly protect the skin and the face from the skin or from the sun. No ball caps, visors, you know, they are basically right here. They protect right there. This side is left very vulnerable. So it's really important. And, you know, we have no excuse these days. I mean, you know, the options are vast, what we have. And, you know, I think companies have come out and they realize the importance of this. So, you know, I encourage everybody to invest in just, you know, 3 or 4 pieces of clothing that you can pull out and, you know, cover up, zip ups, you know, long sleeve with hoods. It's great for walking on the beach, you know, and they're breathable fabrics. So they're not hot. They don't, you know, you won't overheat and get all uncomfortable. So there's no excuse, you know, protect the skin.
Also the tops of the ears, you know, when I was doing a lot of medical dermatology, we would see so many skin cancers on top of the ears, especially in men, because you don't have the hair as often covering that. So make sure you're sunscreening or sunblocking the top of your ears and the sides of your neck. So sun hits the sides of our neck, especially we're wearing a ponytail. We don't really realize that we're out in the sun and it's hitting that so much, but we see a lot of sun damage, especially visible sun damage. It's called poikiloderma de Savate. Dr. Mendelsohn loves that term on the side of the neck, and it's hard to treat. So make sure you put your sunblock on your neck too.
Very good.
Wow, that was great. It was excellent. Let's see. Do you? One thing that I'll say, if anybody of you know these ladies, they are what we describe as results oriented, and I'm only saying that as a compliment, and that means that they want to solve problems. There are patients who go to other salons and have facials and those sorts of things. That's not what these treatments are. I'm not saying that anything is painful necessarily, but they are results oriented, and they are superstars. They are really amazing. So I don't know. I really appreciate that. That was really a great review. So I know there will be more skin topics for us to cover. But Karen, do you have any comments?
Great information.
Okay. Well, good. All right. Well, we'll see you all in a week. Actually, we'll see you tomorrow, but we will be open in a week, and we look forward to seeing you. So have a great day. Wendy, thank you guys.
Thank you. Take care.